Good afternoon, ladies and gentlemen. Cardiac surgery for $800. This is our dream. We are not anywhere close to it, but we are somewhere close to it. The question is, why is it important to do the heart surgery for $800? Why mobile phones are very cheap in US and Europe compared to what it was about 20 years ago? What's the reason? It's because 900 million Indians are buying mobile phones. And we give the numbers to the mobile phone companies, and they are able to reduce the cost so that America and Europe is able to buy mobile phone at a lower price. But unfortunately, same analogy hasn't got converted in healthcare. We are allowed to fend for ourselves. And unless the healthcare blossoms in Asia, Africa, and Latin America, there is no way the cost of healthcare will go down in your country. So if you want low cost, good quality healthcare, you have to help us to reduce our cost. Look at the situation right now in a country like India. In my country, 80% of the national expenditure on healthcare is borne out of pocket. Nearly half the country's population borrow money or sell assets to pay the medical bills because our government spends 1.1% of the GDP on healthcare. And in the process, India requires large number of healthcare interventions, which doesn't happen. And forget about India. 100 years after the first heart surgery, less than 20% of the world's population can afford heart operation. Yeah. So unless India does adequate number of heart operation, the cost of heart operation will not come down in any part of the world. We are genetically 3 times more vulnerable for heart attack than Europeans. When I used to work at the Guy's Hospital in London, my patients were old retired people. In India, they are the young breadwinners of the family. In my practice, it is not the young son bringing his old father for a heart operation. It is the old father bringing his young son for a heart operation. We need to do 2 million heart surgeries a year. And all the heart hospitals in the country put together perform less than 120,000 heart surgeries. And what happens to the remaining 1.9 million people? They die gradually over a period of time. And in the process, we perhaps produce one of the largest number of young widows in the world. How long you will allow this to continue? It is happening because every country, every hospital is working in silos without realizing that the problem of healthcare is not a problem of a nation. It is a problem of the world. And the only way we can address that is by coming together. We have in India 100 towns with a population of 500,000 to 1 million where there is no heart hospital. There is no super specialty hospital where heart surgery, brain operation can be done because they can't afford it. So we worked with India's largest construction company called L&T with the mandate that a 300-bed super specialty hospital should be built it should be built and equipped with an investment of $6 million. In India, it costs about $30 million. In US, it may cost about $400 million. We wanted to build it for $6 million. And we wanted to build it in 6 months. And you can see the hospital is come up, and it is doing extremely well. For the last 1 year, it has been doing extremely well. And day after tomorrow, Professor Mohammad Yunus is inaugurating an oncology block next to this hospital. Now, people ask me, where did I get the inspiration for this low-cost model? This is the replica of Killingbeck Hospital in Leeds, where I used to work 35 years ago. 4 years ago, we decided that we need to use disposable gowns and drapes for a heart operation. 99% of the hospitals in India still use linen. And two big multinational companies wanted us to pay them 5,000 rupees for each heart operation. We were willing to give them 2,500 rupees. They refused to come down. We offered them 12% of the Indian market. 12% of the heart surgery done in India is done by us. We offered them the number. They refused to come down. Then we got hold of local young entrepreneurs. We explained to them how you can make those disposable gowns and drapes. So they created a company called Ameralis. There is no rocket science in making the disposable gowns. The material comes from Alstom. All you need is cutting and stitching. And today, this company has a CE marking. They can export it to most countries. And we are buying the disposable gowns and drapes for them for 900 rupees, which is half of what we use for linen. So it is possible to reduce cost and improve the quality. How do we control cost? We control cost because we have no money. We control cost because we respect money. We have a system, we have an Oracle ERP on a cloud. So by 12 o'clock in the afternoon, all of us senior administrators get a mobile phone, SMS, with the previous day's revenue, expenses, and EBITDA margin. We want everyone in the organization to have total knowledge about the financial health, because looking at the profit and loss account at the end of the month is like reading a postmortem report. Whereas getting the profit and loss account on a daily basis is a diagnostic tool. Our attempt is to reduce the mortality in a hospital. If 200 patients gets admitted to an American hospital and spend just one night in American hospital, which are perhaps some of the safest hospitals on this planet, one person dies due to medical error. It is not medical negligence, it is medical error. Getting admitted to an American hospital is 10 times riskier than skydiving. Why this happens? Because every doctor has his own style of treating. Every doctor behaves like a Superman. We wanted it to standardize the care. That can only happen if you develop the protocol which is available on a portable device, not on a desktop. So we developed an application called iCare, which is on an iPad, where everyone is allowed to think and come up with the concept and the protocol, but nobody is allowed to change the protocol once it is done. Today, when we admit a patient in an ICU, we all want to know who's the intensivist who's taking care of the patient. But when we board a plane, we never ask who's the pilot who's going to fly the plane. Because it doesn't matter whether the pilot has 20 years experience or a 5 years experience, he can fly, cruise, and take off and land in the same manner. But unfortunately, in healthcare, that is not happening. Unfortunately, we have so many rigid regulatory restrictions in using devices. This is the typical physician in US. He has to interact with the 6 devices for any meaningful outcome from a software. This is ridiculous. In US, even today, most hospitals use a pager. In India, if you want to see a pager, you should go to museum. Everybody has a mobile phone. Why can't you use the mobile phone? It is the smartest thing one can think of. So we have started developing various applications to use the mobile phone as the tool of delivering healthcare. Believe me, within the next 10 years, the mobile phone will be the conduit of delivering healthcare. Within the next 10 years, every doctor will be mandated to take a second opinion from his mobile phone before starting the treatment. It is going to happen. Computers are smarter than us, but our smartness is in making the computer smarter. I keep saying it is 10 years, but it is going to happen within 5 years. I say 10 years because I don't want my colleagues to shoot me down. So these are the applications we have developed. We want every patient to have his EMR on his mobile phone. And we wanted every patient to communicate with this doctor, irrespective of the time, using a voice message app in his mobile phone. A resident of ours, I just want to give an idea how desperate doctors are today for proper applications to use the technology. A resident of mine who's undergoing a surgical training program, he wanted to develop a new surgeon's logbook, which is important. And he developed it by spending few thousand rupees and 6 weeks of his time. And without his knowledge, his friends uploaded that app called Surgeon's Logbook in Google Play Store. And in 3 months, without any advertisement, 12,000 surgeons across the world downloaded this app, they are using it. And there are not more than, I guess, 20,000 surgeons in the world undergoing training program, and 12,000 of them are using it. This is the power of creativity. This is the power of user experience. And unfortunately, our industry has failed to take the benefit of this great tool. And I just want to end my talk with the idea that the regulation in terms of credential is the single important factor which has ruined the healthcare and responsible for thousands of people suffering across the world. Why do you need particular degree to do a simple task? I just want to show this picture. This is a beautiful picture in my office. And everyone entering my office, look at the picture and ask me who the painter is. And I ask them the same question. Can you guess who's the painter is? The painter was a trained elephant from Thailand. If an elephant can do this beautiful painting, girls from Indian villages can hand over a surgical instrument when a hernia operation done, but the current regulation doesn't permit. Thank you very much for giving me this opportunity.
Thank you.